Hi, welcome to attend our webinar today. Today we are going to talk about 4 important canine vector-borne diseases, include Ehrlichiosis, Anaplasmosis, Leishmaniosis, and Heartworm diseases. Before we start our topic today, let me briefly introduce myself. I'm Yongchun Luo. I got my PhD degree at Mississippi State University. I also have a DVN certificate in Taiwan. And today the first topic we are going to talk about is Leishmaniosis. Canine and feline visceral Leishmaniosis is caused by Leishmania infantum. Other species such as Leishmania brasiliensis can cause localized cutaneous lesion in South America, also called American Tegumentary Leishmaniosis. These diseases are a group of zoonotic vector-borne diseases caused by various species of the protozoa Leishmania and primarily transmitted by sandfly. There are around 30 species of Leishmania exist worldwide. At least 20 of those species can cause disease in humans. And the disease syndromes in humans are further divided into cutaneous Leishmania, or CL, mucosal Leishmaniosis, ML, and visceral Leishmaniosis, VL. And as for dog, the disease in dog can be divided into visceral Leishmaniosis and American Tegumentary Leishmaniosis. This disease is distributed worldwide, primarily distributed in South Europe, Middle East, Central and South America, and some parts of the United States. And also, travel-related disease can occur in non-endemic regions worldwide. Here we can see the map show the geographic distribution of visceral Leishmaniosis in humans and dogs. It's already across 5 continents like Africa, Asia, Europe, and America, and nearly 100 countries have the disease reported. The main affected host in animals are dogs, and less commonly in cats. And it can also affect humans, rodents, wild candies. The mode of transmission for Leishmaniosis is the sandfly. In the old world, it's the phlebotomous sandfly, and in the new world, it's Lutzomia sandflies. And it's mainly through the blood transfusion as well as vertical transmission can occur besides the sandfly transmission. And then let's check the life cycle of Leishmania infantum. When the dogs, cats, and humans they can get infection when they are bitten by sandfly, and the sandfly carry the pathogen. At that stage, promesticals are inoculated into dermis, and then they can penetrate into the macrophage, and then it can replicate within the phagolysosome of the macrophage. Then the macrophage will rupture, and new macrophages will be infected by the pathogen. And if the host cannot control the infection in the skin, then the pathogen will quickly spread by a regional lymphocytes and the blood to infect the entire reticular endothelial system. And then the mastigotes that are ingested by a female sandfly during the feeding convert back into promastigotes, and replication of the promastigotes within the sandfly complete the life cycle of the Leishmania. The clinical future for the Leishmania infection is variable. Some dogs completely eliminate the infection, and a small percentage of dogs develop severe, life-threatening disease. Some dogs remain persistently but subclinically infected, with the possibility of reactivation later in life with immunosuppression. And these dogs also act as reservoir host and can infect sandflies. And for the major clinical signs include weight loss, inappetence, scaling, and or ulcerative cutaneous lesion, and like fever and conjunctivitis, uveitis, lymphoadenopathy, hepatosplenomegaly, lameness, and even signs of renal failure. Here shows some pictures of the main clinical sign of Leishmania in dogs, Leishmania infection in dogs. You can see the skin infection and the scaling and the ulceration here, and the conjunctivitis and nose bleeding and muscle atrophy, cachexia. This table summarizes the prevalence of different clinical signs in dogs with visceral leishmaniosis. As for American tegumentary leishmaniosis, this is characterized by development of a nodular skin lesion at the site of a sandfly bite that enlarges and eventually may ulcerate. And lesions most often occur on regions of the body that have less hair, such as nose, perineal regions, scrotum, and pinna. And if the dog, we suspect the dogs got the infection, how do we do the diagnosis? The main diagnosis assay for the Leishmaniosis include the cytological examination and Leishmania culture. Also, in clinical, we can check the antibody serology, that including the IFA, ELISA, or the rapid test that may detect the antibody of Leishmania impetus. as the molecular biology molecular diagnostic method well developed now, we can also check the PCR or real-time PCR assay, and also the histopathology also can help us to diagnose the disease. Once the infection is confirmed, the main treatment for the Leishmania, we summarize the treatment and the medication in this table, include like the drug this here, and what's the dosage, the route, the frequency of the medication, and the duration of the treatment. And to help to control the disease, the most important is the prevention of the vector. As for the vector control, we can use the parasiticides with repellent activity. And also there's vaccine. There are vaccines available for the Leishmaniosis. As for prognosis, it depends. It varies a lot. It can range from good to poor, depending on disease stage. And one thing need to be noted is treatment is rarely curative, and dogs usually remain infected for life. But without treatment, the death usually occurs within 2 to 3 years from onset of clinical sign due to the renal failure. And then we'll introduce the heartworm disease. Heartworm infections in dogs have been diagnosed around the globe. The environmental and climate change and animal movement have increased heartworm infection potential. And a pivotal prerequisite for heartworm transmission is a climate that provides adequate temperature and humidity to support a viable mosquito population, and can also sustain sufficient heat to allow maturation of ingested microfilaria into the infective third stage larvae, or L3 for short, within this intermediate host. And let's check the mosquito vectors. Any mosquito species that allows for the successful development of microfilaria into the infected L3 stage and subsequent migration to the proboscis can be a competent vector of the the heartworm disease. When the trapped mosquito randomly collected at various locations have demonstrated heartworm infection rate in mosquitoes ranging from 2 to 19.4% in non-endemic areas, so that's a lot. When the mosquito sampling was restricted to canal structures where long-positive dogs were being housed, the infection rate of the mosquito in this sampling resulted in rates of around 30% adjustment to and 74% inside the facilities. This map shows the presence of the both heartworm disease pathogen and the other non-pathogenic pathogen infection around the world. The life cycle of the heartworm disease, we can check when a mosquito got a blood meal from a microvilli host. This microvilli can develop into larvae stage 1, L1, and then molting into L2 and L3. And this, if the temperature is at 27 degrees and 80% of relative humidity, this development just takes about 10 to 14 days. But if the temperature is cooler, then it will take longer time. And when the mosquito got a blood meal from the host, the larvae will enter animal's body by the punctual wound. As early as day 3 and by day 9 and 12, the L3 will mold it into fourth stage larvae, the L4, and then a final mold into Juvenile or immature adult occurs between days 50 and 70. And these immature adults reach the pulmonary vasculature as early as day 67, and all have arrived by days 90 to 120. And once they are sexually mature, then this sexual maturity occurs about day 120 post-infection, with those developing patent adult worm typically live 3 to 5 years, while the microvilli may survive for up to 2 years in dogs. The main clinical signs include for the of the heartworm infection include cough, exercise intolerance, and then some like cyanosis, dyspnea, hemoptysis, collapse, ascites when the right side of congenital heart failure occurs. And based on the severity of the clinical sign, we can divide them into mild, moderate, severe, and terrible syndrome. So how do we diagnose if a dog have the heartworm infection? The companion animal parasite and the American Heartworm Society recommend that all dogs, including those on heartworm prevention, should be tested annually using both antigen and microvilli test. All positive antigen tests should be confirmed through additional testing prior to administration of any therapy. And a negative antigen test results does not confirm that a dog is free of heartworm infection, and all dogs should be tested for microvilli. Also, here, let's see how do we do the primary screening. For the primary screening, the antigen test like ELISA or the rapid test, and a positive heartworm antigen test just indicate the presence of specific heartworm antigen. And currently, all positive antigen tests are recommended to be confirmed through additional testing, like microvilli test or some other test prior to the administration of any therapy. And for microfilaria test, the recommended method is modified NOT test. It can check the absence or presence of the microfilaria. And under the microscope, we can observe morphology and measuring body dimensions to differentiate the D-emittis from non-pathogenic filaria species such as Acanthocerolima. Other diagnostic aids include radiography. Radiography can assess the severity of heartworm cardiopulmonary disease secondary to the heartworm infection. And also the echocardiography can provide definitive evidence of heartworm infection, and also allows for assessment of cardiac, anatomic, and functional consequences of the disease. And molecular diagnosis is particularly appropriate for dogs suspected of being infected, but with microfilaria negative results. That means if the what it means for the molecular diagnosis is it's good for if the microfilaria number is low and we cannot check from the microfilia test, cannot observe the microfilia, and this PCR method is good for the confirmation if the dog suspected of being infected, but the microfilia show negative results. And for the prevention, the heartworm disease is preventable despite the dog's inherently high susceptibility. And because of all dogs living in heartworm endemic areas are at risk, the preventive medication are a high priority. Puppies should be started on prevention consisting of macrocyclic lectin as early as possible, no later than 8 weeks of age. In highly endemic region, the addition of mosquito repellent or ectoparasiticide is warranted. Puppies started on heartworm preventive after 8 weeks of age should be tested 6 months after the initial dose and annually thereafter. And for the heartworm preventive for dogs, is mainly the ML class of drug that include ivermectin, miomycin, oxamine, moxidectin, and selamectin. Those are currently still on the market for the heartworm preventive. This drug affects microfilaria, third and fourth stage, the L3 and L4 larvae. And in some instances of continual use, they can also affect the pneumonia and adult heartworm, but there are many affect the microphilia at L3 and L4 stage. And in addition to the preventive treatment, the better control is also important. So an EPA registered mosquito repellent and reduction of exposure of the dogs to the mosquitoes will also help the preventive of this heartworm disease. And then let's check the medication for treatment. The goals of any heartworm treatment are to improve the clinical condition of the animal and to eliminate all life stages of the heartworm with minimal post-treatment complications. When dogs exhibiting significant clinical signs of heartworm disease should be stabilized before administration and adulticide. And also important is exercise restriction during the entire treatment and recovery period is essential for minimizing cardiopulmonary complications. And for the treatment, both the American Heartworm Society and Europe Society of Leishmaniosis and angiostrongylosis, they recommend 2 to 3 months pre-treatment with an MLO combined with an antibiotic against Wolbachia, such as doxycycline, prior to administration of 3 doses of adulticide. The doxycycline is mainly to try to kill the Wolbachia bacteria. That's the figure. So for the preventive medicine, it's mainly work in L3 and L4 stage, and the adulticide mainly work at the mature heartworm. And also we need to combine them with the better control. If we can combine these 3 together, then the heartworm disease should be effectively prevented. As for adulticide therapy, the main medication is the malasomine dihydrochloride. Right now, the 3-dose protocol is recommended. It's 1 injection of 2.5 milligram per kilogram body weight, followed at least 1 month later by 2 injections of the same dose, 24 hours apart. And also just remember, exercise restriction is essential. Okay, and then the last part we'll talk about the canine anaplasmosis and Ehrlichiosis. Before the molecular diagnostic tool well established, those 2 pathogens have a similar morphology on the plasmia. At that time, we thought they were the same genus of the bacteria. Later on, when the diagnosis sequencing data show that those 2 are actually belong to different, they are actually apart from each other. So right now they are classified into 2 different genus of the bacteria. One is genus of Ehrlichia, the other one is genus of Anaplasma. For canine anaplasmosis, that's a tick-borne disease caused by Anaplasma preti or Anaplasma phagocytophys. The Anaplasma phagocytosis has a tropism for granulocytes and cause granulocytic anaplasmosis. For Anaplasma platy has a tropism for platelets and cause canine cyclic thrombocytopenia. And here this table summarizes the important Anaplasma species pathogen. In addition to Anaplasma phagocytosis and Anaplasma platy, and we can also see the Anaplasma bovis. This one is mainly infect the cattle, so we won't discuss this issue here. So let's check the Anaplasma phagocytosis and Anaplasma platy. The Anaplasma phagocytosis mainly infect the cells like the granulocytic cells, like especially neutrophils, and may also infect the eosinophil and monocyte. But for Anaplasma platy, it mainly infect the platelets, and they also have a different transmission vectors, just listed here. And the other big difference between these two species of Anaplasma is that Anaplasma platy mainly infect dog, but for Anaplasma phagocytosis, it not only infect dogs, but also cattle, goats, sheep, wild ruminants, and humans. And for canine Ehrlichiosis, it's also, of course, also a tick-borne disease caused by Ehrlichia spp. Ehrlichia canis is mainly the main species cause the canine Ehrlichiosis is Ehrlichia canis. This can cause canine monocytic Ehrlichiosis, and the main host is dogs and wild canis. For Ehrlichia agents known to infect dogs and cats, including the Ehrlichia, of course, Ehrlichia canis, and also Ehrlichia cophensis, Ehrlichia wingi, and they have their own vectors also. And for Ehrlichia canis, the common host, natural host, is just the dogs and some canis. So if just put it simpler, Ehrlichia canis and Staphylococcus target the monocyte, and Ehrlichia wingi can infect the granulocyte, and Anaplasma phagocytosis target the granulocyte, mainly neutrophils, and for Anaplasma platy infect the platelet. Both of them are tick-borne disease, so the main route of transmission is by a tick bite. One thing different from another tick-borne disease, Babesia, is that for both Anaplasma and Ehrlichia's pathogens, they can only transmit by a transtadial transmission, but no transorbarial transmission. That means no ovary transmission for the Ehrlichia and Anaplasma pathogens. In addition to the tick bite, the other possible transmission route is by a blood transfusion. So for the For the blood donor of dogs, the pathogen screening is important. Need to make sure those blood donors don't have this disease. As for clinical signs for anaplasma and Ehrlichia, we are just listed in this slide here. For anaplasma, it may have some issue with movement because of the lameness, and may have breathing disorders. But infected dogs sometimes are often asymptomatic. As for Ehrlichia, it also have the breathing disorders. You may see the breathing sign of the skin, mucous membrane, and in the ocular, and also may have ocular signs and neurological signs caused by the Ehrlichia infection. There's just some figures show those signs. The breathing issue in the mucus, also the nose bleeding, and under the skin mucus and ocular. As for clinical pathology, the anaplasma, if it's caused by Anaplasma platy, and we can see thrombocytopenia. And for both Anaplasma platy and phagocytosis, you can see leukopenia, moderate anemia, and some mildly elevated liver enzyme. For Ehrlichia infection, you can also see the thrombocytopenia, and this is the most consistent hematological abnormality in infected dogs, and may also see non-regenerative anemia. So how do we diagnose the infection of both Ehrlichiosis and Anaplasmosis? The easiest one is by a blood smear. From the blood smear, we can see intracytoplasmic cluster of bacteria in granulocyte, like this, like this, and like this, or in the platelet, like this, like this, like this. And this blood smear method is rapid. The advantage for blood smear examination is rapid and inexpensive, but of course it's has low sensitivity and poor specificity if the person do the test is inexperienced. The other in clinical diagnosis method is serology. You can check ELISA, IFAT, or rapid test. And this serology test is highly sensitive. It can demonstrate exposure to infection, but not necessarily current infection of disease. And this antibody it takes 3 to 4 weeks for antibodies to develop post-infection. So this one is a useful screening for exposure to infection, but should always be interpreted in light of clinical signs and patient history. The other method for diagnosis is PCR. PCR is very sensitive and specific detection method. It can show and prove the current infection of this disease. And the pathogen, or the nucleic acid of the pathogen can be detected from the blood samples as early as 4 to 10 days post-infection. So once we confirm the infection of these two diseases, so how do we do the treatment? The main treatment for both diseases is antibiotics, doxycycline. You can either use 5 mg per kilogram twice daily or 10 mg per kilogram once daily. For the duration of the treatment, Ehrlichiosis suggests the whole treatment is 4 weeks. As for Anaplasmosis, about 2 to 3 weeks. As for Anaplasmosis, 8 to 10 days. And if the dog is in acute cases, is in acute phase, the clinical improvement is normally seen within 24 to 72 hours. And other supportive care, like if the kidney issue, if the renal compromise, we can do some supportive care for kidney or the blood transfusion in case of severe anemia, or some plasma or blood products for severe thrombocytopenia. As for prevention, all the tick-borne disease, the main prevention method is use of tick prevention products, and also checking for ticks may be necessary, especially for dogs. If they are in situation of high risk exposure, then those dogs should be checked for ticks at least every 24 hours. So that's for today's seminar. We'll take a short break and then come back for the Q&A. Thank you. Hi, welcome back to our Q&A session. Here we will answer 3 questions, and if you have some other questions, welcome to leave the message. We will come back later to you. The first question is, can heartworm be transmitted to unborn puppies? The answer is, the transmission of heartworm requires a bite from an infested mosquito, so direct transmission from the mother to her unborn puppies is not possible. It is possible for microscopic baby worm, the microfilaria, to pass through the bloodstream of the mother into the puppies. However, these worms cannot develop into adults and should be eliminated when the puppies receive their first dose of heartworm preventive, and then the worm will be eliminated eventually. And the second question is it safe to treat heartworms in a pregnant or nursing dog? The use of the Adulticide Therapy in pregnant dogs has not been studied. In case where a litter will be carried to term, adultery therapy should be delayed until weaning, unless immediate treatment for severe infection is indicated as a means of preserving life. And the last question is, what samples should be chosen for to perform a molecular diagnosis of Ehrlichia and or Anaplasmosis infections? The sample of choice for a PCR assay is peripheral blood with EDTA. Some studies have suggested that splenic aspirates seem to be optimal specimen for the diagnosis of E. canis infections based on PCR. When microscope examination reveals structural suggestive of moruli in the cytoplasm of neutrophils or mononuclear cells in any tissue or fluid, PCR can be used to corroborate the diagnosis. So that's for today's seminar. If you have some other question, you can still leave the message and we'll come back to you later. Thank you very much for the attending.